RV Escadot from Level 4, Block A.
I'm Eva from Level 3, Block C. I am Michelle Diatagi from Level 3, Block C. And I am Princess Elveo from Level 3, Block C.
Good day. We are the group assigned to present about one of the communicable diseases, which is the poliomyelitis. The contents of our presentation includes about the disease, its overview. We also have the causative agent. This section actually houses the structure of the virus, the vector, the types of polio, the incubation period, and the mode of transmission. We also have the laboratory or the diagnostic test. We opted to include here the signs and symptoms of polio. We also have the medical treatment, the nursing intervention that includes the assessment and the diagnosis, and lastly are the ways on how to prevent polio. I am RV Escadot from Level 4 BSNA. Together with me are Miss Flora, Miss Hatage, and Miss Jacob. Now let us learn about the poliomyelitis. So I am tasked to present about the overview of this disease. So this includes the definition, the prevalence, the incidence, the mortality rate, and the types. Later on, we are also going to discuss about it. Now, poliomyelitis, polio means gray, myel means marrow, and itis means inflammation. So it is actually the inflammation, as you can see from the picture, it is actually the inflammation of the anterior horns of the gray matter of the spinal cord, leading to a destruction of the large multipolar cells of these horns. Now, poliomyelitis is also known as the infantile paralysis, and which is actually a highly infectious disease caused by a virus, and it invades the nervous system and can cause a total paralysis of the matter in a matter of hours, which mainly affects the young children. And we all know that polio has been around since the ancient times, and if you can read in the Bible, we can also find this in the Bible. And as you can see from the picture, this is an Egyptian tomb painting that shows a man with withered legs unable to bear weight without the use of a walking stick. So dugay ra jud ni siyang polio, and still naghihapoy cases ani, but very kanang kuha na siya, like minimal. However, we still need to discuss about this since it is a communicable disease. Now, who are at higher risk for this exposure, for the exposure of this communicable disease, which is the poliomyelitis? Now, the people that are at higher risk, according to the CDC, or the Centers for Disease Control and Prevention 2022, anyone who is not fully vaccinated against polio is at risk for polio. However, there are some situations that put people at risk for exposure to polio, such as travelers who have recently visited polio endemic countries. So such countries includes the Afghanistan or the Pakistan, or kanang mga countries nga naay kanang experiencing polio outbreaks. People higher at risk also includes the laboratory and healthcare workers who are kanang handling specimens that might contain poliovirus. We also have the healthcare workers nga katong nag-treat og patients who could have polio or have close contact with a person who could be infected with poliovirus. We also have the unvaccinated adults whose children may be receiving oral poliovirus vaccine while living abroad. So they are higher at risk for the exposure of polio. So for the incidence and prevalence rate, our country, the Philippines, was declared polio-free in 2000, and the last case of wild poliovirus was recorded in 1993. So dugay na gyud kay siya, wala siya kanang mga recent outbreaks. The declaration of polio outbreak followed a confirmed vaccine-derived poliovirus type 2, or the VDP-V2, case in the 3-year-old child in Lanao del Sur, Mindanao, reported on 16th of September 2019. So, bali na i-declare nga polio outbreak and then naapoy vaccine dayon siya nga naagapan ang recent case which is atong 2019 sa Lanao del Sur diri sa Mindanao. And subsequently, another VDP V2 case of polio was confirmed on September 20, this time in the 5-year-old boy who was immunocompromised from Laguna, which is adjacent to Metro Manila. So dili jud kay siya kanang like outbreak nga kanang such cities kay maka-experience. However, kanang mga 5-year-old, 3-year-old, but kanang isa lang ka case or 2 cases, inana lang siya, dili gyud siya na outbreak, gyud siya nga outbreak. And there have been no new polio cases reported after 15 February 2020. So from there on, wala na gyud siya new cases. Now, cases due to wild poliovirus have decreased by over 99% since 1988. So 1% gyud siya ang mga cases ani. From an estimated 350,000 cases then to 6 reported cases in 2021. So inana siya ka decreased ang iyahang incidence and prevalence rate. Now, for the mortality rate, the case fatality ratio is generally 2% to 5% among children and up to 15 to 30% among adolescents and adults. It increases to 25% to 75% with bulbar involvement. So, mas mo-increase ang cases or mulala ang case if naay bulbar kanang involvement, like apil ang medulla oblongata, since ang kaning poliomyelitis kay ang na-involve ani, di ba, like sa previous nga slide, it talks about the spinal cord, like ang bone marrow sa ato ang spinal cord. So kung maapil ang medulla oblongata, mas taas yun siya ang cases, like may increase siya to 25 to 75% with bulbar involvement. Now, the mortality rate from 2019 to 2020, 0% siya in the Philippines with a total of 17 cases, like from the start to now. So 17 cases are siya. Now, for this part, may I call on Miss Flora to present to us about the causative agent, the vector, the incubation period, and the mode of transmission. The virtual floor is yours.
Thank you, Ate RB. So now let's talk about the causative agent of poliomyelitis, which is the vector, the incubation period, and mode of transmission. So the causative agent of poliomyelitis, it is the Ligio debilitans or poliovirus. So poliovirus came from human and it lives in throat or intestines of the human, and it is the smallest known virus RNA with a spherical capsid of 25 to 35 nanometer of diameter and 1 billionth of meter. So next, for the vector of poliomyelitis is flies, or in Filipino we call it langaw. It is the mechanical vector caused by contact with infected fecal matter transferred to food, etc. From the sponging mouth parts, exoskeletal hair and bristles and vulvi of the housefly. And then, so there are 5 types of polio. First is we have a abortive poliomyelitis. It causes a flu-like and intestinal symptoms. It only lasts a few days and doesn't cause long-lasting issues. Next, we have non-paralytic poliomyelitis may cause an aseptic meningitis, swelling of the area around your brain. It causes more symptoms than abortive poliomyelitis and may require you to stay in the hospital. We also have paralytic poliomyelitis. It happens when poliovirus attacks your brain and spinal cord. It can paralyze the muscle that allow you to breathe, speak, swallow, and move your limbs depending on what part of your body are affected. It is called spinal polio or bulbar polio. Spinal and bulbar polio can appear together, or that what we call bulbospinal polio. Less than 1% of people with polio get paralytic poliomyelitis. Next is we have a polioencephalitis. It is a rare type of polio that mostly affects infants. It causes brain swelling. And the last one, we have post-polio syndrome. It's when symptoms of polio came back years after a polio infection. So for the incubation period, the incubation period of poliomyelitis is 3 to 6 days for non-paralytic poliomyelitis and 7 to 21 days for onset of paralysis in paralytic poliomyelitis. For the onset of paralysis in paralytic poliomyelitis, the incubation period is usually 7 to 21 days. The risk of severe disease and death following primary infection with poliovirus increases with increasing age. Paralysis is often permanent. So paralysis is often permanent, although total or partial recovery can occur though through compensation by muscles not affected. Weakness or paralysis present 12 months after onset, which occurs in two-thirds of patients with paralysis is usually permanent. So paralytic disease may be caused by a wild type polioviruses, attenuated polioviruses in oral vaccine, or by vaccine-derived polioviruses. Paralytic disease with similar clinical manifestation may be caused by natural occurring wild-type polioviruses, by the attenuated viruses contained in the oral poliovirus vaccine or the Sabin strain in extreme rare occasions, or by the vaccine-derived polioviruses or the VDPVS, which are Sabin vaccine strains that have reverted and required the virulence and transmissibility of wild polioviruses. So, for the mode of transmission of the poliomyelitis, so it spreads through direct person-to-person contact, contact with infected mucus, phlegm, and or feces, and then contact with contaminated food and water. And an infected person can spread the virus to others immediately before and up to 2 weeks after symptoms appear. The virus can live in an infected person's intestine for many weeks. It can contaminate food and water in unsanitary conditions. People who don't have symptoms can still pass the virus to others and make them sick. So that's all for the causative agent. And now for the laboratory and diagnostic test, may I call on Michelle Hatage.
Thank you, Flora. So now I will be reporting about signs and symptoms of poliomyelitis as well as its laboratory and diagnostic test or examination. So we will first talk about signs and symptoms. So between 70% or 90% of people infected with poliovirus don't have any symptoms. But therefore, for those people who have symptoms, they mostly experience mildest form or what we call abortive poliomyelitis or either non-paralytic or paralytic symptoms. But first, we'll talk about the symptoms of abortive poliomyelitis. So, abortive poliomyelitis symptoms are similar to many other illnesses. So, they start 3 to 7 days after getting infected and last a few days. So, symptoms of abortive poliomyelitis include fatigue or tiredness or lack of energy, fever, lanat, headache, sakit imong ulo, vomiting, pagsuka, diarrhea or constipation or kanang kalibanga or either sore throat. So sore throat is part of the signs and symptoms for polio since polio virus, which is the causative agent of poliomyelitis, is a human virus that usually live in the human throat or intestine. And next, let's proceed to the symptoms of non-paralytic poliomyelitis.
So, non-paralytic poliomyelitis starts with the same symptoms as abortive poliomyelitis. So, additional symptoms start within a few days, including neck stiffness, pain or pins and needles feeling in your arms and legs. So, murag nagatusok-tusok na pamati nimo sa imong arms and legs. Severe headache, sakit kay imong ulo, and sensitivity to light or ginatawag na to photophobia. And also, next is the symptoms for paralytic poliomyelitis. So, paralytic poliomyelitis starts out with the symptoms similar to abortive poliomyelitis or non-paralytic poliomyelitis. And additional symptoms can appear days or weeks later. So, it includes sensitivity to touch and muscle spasms. So there are also signs and symptoms for person who might have a poliomyelitis. So a smaller portion of people with poliovirus infection will develop other or more serious symptoms that affect the brain and the spinal cord. So here, first signs and symptoms is ang meningitis. So meningitis is an infection of the covering of the spinal cord or your brain. So it occurs about 1 to 5 out of 100 people with poliovirus infection depending on the virus type. And also nasa paralysis. So sa paralysis, then you can move parts of your body. So either sa imo ang lower or upper extremities. So naayo kay ma-feel nga weakness sa imong arms, legs, or both. Mo-occur ni siya about 1 out of 200 people to 1 in 2,000 people, depending po also sa virus type. So, ang paralysis, it is the most severe symptoms associated with polio because it can lead to permanent disability and even death. Okay, so that's all for the signs and symptoms. Now, let's proceed to the laboratory or diagnostic tests. So, the question is, what tests are used to diagnose polio or how it is being diagnosed? So, poliovirus can be detected in specimens from sa throat, sa feces, or sa stool, and occasionally sa cerebrospinal fluid or the CSF. So, it will be isolated or the virus will be isolated in the cell culture or by detecting the virus by polymerase chain reaction or sa PCR. So there are following diagnostic tests conducted to diagnose poliomyelitis. So first is the lumbar puncture or spinal tap. So it may be used to take a sample of fluid from your spinal cord to help diagnose a condition. So as you can see sa on the right side of the PowerPoint, namoy makita nga image. So that is how lumbar puncture is done. And the next is the blood culture. So from the word blood, diba? So it checks samples of blood for presence of disease-causing germs if na bacteria or fungi. So kani pud siya, ginabuhat pud ni siya because blood is tested for antibodies para poliovirus. And then when a person is infected with poliovirus, special tests can detect the level of poliovirus-specific antibodies and can confirm the diagnosis. So, sa right side po sa inyo ang sa presentation na po makita how blood culture is done. And the next is we have the throat culture or throat swab culture. So, this throat culture is the test of germs or bacteria in the back of your throat. So, as I've said earlier, as I have mentioned, that poliovirus is a human virus and it is usually lives in the infected person's throat or intestine. And also, since most people sab as I said po kaganina that will not have any kanang visible symptoms. So since kay ang poliovirus is usually existed sa infected person's throat, so this throat culture is also very important as part of the diagnostic test for poliomyelitis. And then for the last one, we have the stool test. So the stool test, it looks at the fecal matter for evidence or a medical condition. So kuha ni siya sa atuang tai. Test na siya dito so that it can help diagnose also if person is positive or negative for poliomyelitis. And then also, the test may look for evidence of infection or allergy or blood or digestive problem. So probably to increase the probability of isolating poliovirus, ang pag-collect pod sa stool specimen is about 24 hours apart from the patient with suspected poliomyelitis. And also, kaning pag-collect sa stool specimen is should be collected as early in the course of disease as possible, or ideally within 14 days after the onset. So for the laboratory diagnostic tests, we have the lumbar puncture, blood culture, throat culture, and stool test. So that will be my part rather. And now for the medical treatment and nursing intervention and prevention of poliomyelitis, may I call on Princess Lai Jacob.
Thank you, Rachel. And now I will going to discuss or report the medical treatment. So for the how is polio treated? There are no specific medications to treat polio. If you have the paralytic polio, you'll receive a physical therapy. Paralytic poliomyelitis happens when the polio virus attacks your brain and spinal cord. It can be paralyze the muscles that allow you to breathe, speak, swallow, and move your limbs depending on what parts of your body affected, and it's called the spinal polio or um, bul- bulbar polio. And also, if your breathing muscles is weakened or paralyzed, you'll need to make mechanical ventilation, a machine that help you breathe, and also drinking fluids such as water, juice, and broth using heat packs of help muscle aches, and also taking pain relievers such as ibuprofen, Advil, and Motrin, and also doing physical therapy and any exercise recommended by your healthcare provider, and um, and getting plenty of rest. There is no cure of polio, only treated to manage the symptoms. Mild cases usually treated with plenty of fluids and plenty of rest. For the nursing intervention is first, for the nursing, it's a part of the nursing assessment history. Obtain a history of a vaccination, travel, and contact with recently returned travelers. Physical assessment, observe the client for possible signs and symptoms of polio as listed above, like nausea, vomiting, fatigue, fever, and also the sore throat. And for the nursing management, part of the nursing diagnosis, balanced nutrition less than body requirement related to anorexia, vomiting, and nausea. And ineffective thermoregulation related to the infection process, ineffective airway clearance related to muscle paralysis, and effective breathing pattern related to muscle paralysis, and acute related to the infection that attacks the nerve, impaired physical mobility related to paralysis, and also anxiety in children and families related to disease conditions. For the prevention, there are two types of the vaccine that can prevent polio. First, inactive poliovirus vaccine or IPV, given as an injection in the leg or arm depending on the patient's age. Only IPV has been used in the United States since 2000. Oral poliovirus vaccine or OPV is still used throughout much of the world. So, healthcare officials recommend four polio shots in childhood. First is first shot of the 2 months old, second shot for the 4 months old, and then the third shot between 6 and 18 months old, and then booster shot between 4 and 6 years old. So if you're never been vaccinated for polio and it's recommended you to get vaccinated as an adult, you'll get the three shot. First is two doses um, to 2 months apart. Then second is a third dose 6 to 12 months after the second. Then for the polio vaccine prevention, according to the Centers of Disease Control and Prevention, it is protects children by preparing their bodies to fight the polio virus. Then next is almost all children, more than 99% who get all the recommended doses of the inactive polio vaccine will be protected from polio, and Next, it is important to practice a good hand hygiene and also hand washing, often with soap and water. The note is alcohol-based hand sanitizers do not kill polioviruses.
So thank you, Princess. So that will be our report. So thank you so much for listening, and I hope that you have learned something on our presentation. So our reference is listed below. Thank you and God bless.